Hello, y'all. Let me slide back a little bit so you can see a little bit more of me than just the top of my head. I hope you're doing okay. It's Suzette Viernon, and welcome to my channel where I'm redefining my 60s on my own terms. As you know, the last few episodes I've done have been mainly about Agenda 47, Project 2025, as our election is fastly approaching. But there's something else that's fastly approaching for me, and that is age 65. And so this year I am eligible for Medicare. And I found that there are quite a few of people who listen to me who are almost there or right alongside me in trying to navigate and figure this thing out, right? And so I want to come on and share with you just a few things that I found very helpful in deciding how I was going to go about it, what Medicare Part A, Part B, Medicare Advantage, you got A, B, C, and D, and all these things that you just kind of hear thrown around. And if you're like me, I started getting all this mail from these different insurance companies, and I was just like, I don't know what to do. Some were talking about supplemental insurance and some were talking about Medicare Advantage and all that. And I was just like, I don't know what to do with all of this information. Information overload, for sure. So what I did was I decided to go on Facebook. I was part of a senior group. The group was, I think it was it AARP? Like, there was a group called the Soul Sanctuary for AARP members, something like that. And I just posted, I just made a post that said, listen, I am confused about Medicare. Can you give me any feedback, any experiences, give me any insights into this, because I don't know what the heck I'm doing. I don't know how to disseminate all this information that I'm being bombarded with, so please help me. And to my surprise, I got a whole lot of people chiming in. So that was great, right? But then no two people seemed to have the same answer. Some said go with original Medicare. And original Medicare is Medicare Part A, Part B. You go to the Social Security Administration, you go through that. It's what they call regular Medicare. Then some people said, well, no, you want to go with Medicare Advantage because there are some incentives for you to go that way. Medicare Advantage might include dental, vision, and some other things like gym memberships and that kind of thing. And that might be the right way to go. Then other people said, no, don't go that way. Don't go that way. Go with the original and get you supplemental insurance. And I was like, okay, I think the best advice I got was talk to a broker. Talk to an insurance broker. And they cautioned me and said, now there's a difference between a broker and an insurance agent. You don't want to go with an insurance agent because they're going to try to sell you on their product. Go with a broker who has a suite of different options that you can explore, you can look at. They're not necessarily favoring one over the other, and you can really have a chance to really look at more variety in the different plans and suggestions. That's what I did. And so I'm currently working with an insurance broker. And tonight we're going to be having our second or third, I think it's our third meeting I was sent away with little homework assignments. And so we're getting closer and closer. I think I already know what the best thing for me is, given my own unique set of circumstances and needs. And so what I wanted to do was give you a few suggestions, recommendations, things to think about, maybe the way to approach this thing so that you don't pull your hair out or decide to go with some type of plan and find out later it was not what you thought, it's inadequate. So I suggest these things, okay? And I'm going to try to keep it under 10 minutes, okay? So if you need a pencil and paper, grab it, put this on pause, grab it, and I'm going to go through some things pretty quickly. All right. So first thing I did was I just posted it in a seniors group. It doesn't have to be an AARP group. It can be if you're in any kind of senior leaning group. You know, maybe you're the sexy silver sisters over age 60. Whatever that group is, that might be in the 60s age range on up, which is what my group was. I'm in several. But I was able to post in the group and get some real-time, honest feedback to look at. And then the best way, you can look at all the feedback and ask questions, and you can find out a lot of information just from people elaborating. But the one thing that I say that I encourage you to do is when you get close to Medicare age, you will get a booklet, a Medicare booklet that breaks down everything about Medicare, everything about the program, everything about the options, Medicare Part A, Part B, Part C, Part D. They might even go through some of the other alphabets with you, right? And so it tells you everything you know, and it breaks it down for you. And I'll tell you, I read the book after I checked in with my broker, but I would have had a more productive conversation with her had I read the booklet before I sat down with her. So I suggest you read the Medicare booklet first, you know, and if you want to post to a group to get some honest feedback from actual people, that's what I wanted to do as well. And then I worked with the broker, okay? And it kept me from pulling my hair out, okay? That's one thing. The other thing that I recommend is as you're looking at the different options, either before or while you're looking at them, you need to get very, very clear about exactly what you need. Don't go for everything that's shiny. Lead with what you actually need. What has your history been? Do you spend more money on prescription medications? Do you have a chronic illness? Right? Do you have to get allergy shots every month? Do you have diabetes? These are things that you definitely need to make sure of. In my case, I was diagnosed with osteoporosis, right? So that was a major consideration for me. Also, I have dense breasts. So when I have a mammogram, I have to go with the 3D, and I think there's another one too, but there was a diagnostic mammogram that with my previous insurances, I'd have to pay more out of pocket because my insurance didn't cover a diagnostic mammogram. They covered the regular one, but they didn't cover a diagnostic. And so what I have learned is because my breasts are dense, I need to have insurance that has a reasonable copay for a diagnostic mammogram, right? For DEXA scan, those kinds of things. So make sure you're very, very clear about what your needs are. Also, go back and look at some of your old doctor bills and look and see how much it would have cost you had you not had insurance. What would it have cost you? That's a very important thing too when you're trying to determine what the co-pays are, whether you should go with an HMO whether you should go with a PPO, whether you should go with an EPO. I found out about that, or whether you want to go with regular Medicare. So that's a very, very important thing. Now for me, because glaucoma runs in my family, I need to have something with vision coverage. Not just with a regular eye exam, but also diagnostic testing for glaucoma. That's a consideration for me, right? Because I don't have any major dental issues. Regular dental works for me. So I wrote all those things down, what I would normally do in a year, how often I would normally go to the doctor, what are the things that send me to the doctor, those kind of things. And I would suggest that you look at least for 2 years. Pull your receipts, look back at your calendar, look at the reasons you went to the doctor, right? Look at whether you maybe didn't go to the doctor as much, but you went to the ER a couple of times in that year, which is what happened to me. I'm a reasonably healthy person, so I very rarely over this year, I might have gone to the doctor once for my yearly physical and maybe one other time, one or two other times. I just don't go or need to go to the doctor, right? So, but when a couple of things happened, I had to make a couple of trips to the ER. And I'm going to tell you, if you don't have real good insurance coverage, going to the ER is really expensive. When they added up everything for my ER visit, one ER visit came to about $5,500. That's with all the tests and adding the physician costs, because they bill you separately for all these things. When I added it all together, it came to about $5,500, right? So things like that, urgent care. If that's where most of my medical costs came from, then I definitely want a plan that's going to have a reasonable, affordable copay, right? So those were things that we looked at when I talked with my broker. Something else that's very important is when you narrow it down to the plans that look really good, narrow it down to at least 2. And then a lot of these plans have a tool on their website where you can find your doctors, right? So you can do a search to see if your physicians are in network. I encourage you to not only include your primary care doctor, your dentist, your eye doctor, but include if you had to go to an orthopedist or podiatrist, or who your GI doctor was when you had your colonoscopy. Any specialty kind of physicians, because right now my knees are doing very well. I went to an orthopedist who did hyaluronic acid shots in my knees. Not steroid, but something that mimics the fluid that your knee normally has. And so, but that was kind of expensive. So I would definitely want to make sure that that physician is in network, as opposed to maybe being out of network and it costing a whole lot more, or there is a separate specialist cost, that kind of thing. So it's very important for you to really look through your receipts, look at your calendar, and see what physicians you have seen and which ones you might likely see. Because even though my knees are working well now, as I get older, I'm going to still have to probably have that procedure again, or that shot again, to replace that fluid, right? To have that fluid so that my knees continue to do well. I love line dancing and I love dancing in general. So my knees, I need to be able to, get down with the get down, right? Okay, so that's important to me. So that's very important. I'm going a little over in time, but I think you all will appreciate what I'm sharing with you. Another thing, research the contract status. Research the contract status of the plan that you're looking at. Because let's say it's United Healthcare or Blue Cross Blue Shield or Humana. Look at the contract status that they have with your hospital to make sure that the contract has been renewed. Because if there's any kind of contract dispute, then that could hinder your ability to get coverage for something that you need. For example, I was getting physical therapy when my provider and the hospital facility that I was looking at were in dispute. And because they could not reach an agreement, I had to find another place to have physical therapy because continuity of care was not an option for that particular situation. So make sure you do your research. Make sure that the plan will cover you for the upcoming year, that you're looking at, that it's not going to drop coverage, leave you in a situation where they have to put you on another plan that may not be as good. Do your due diligence to research that kind of information. If you're working with a broker, make sure you discuss that and make sure she checks all that out for you as well. She or he, okay? And those are the main things I wanted to bring up in this sit down with you. Make sure even if you're using a broker, Google will be your friend. Google some things, research some things, talk to some people, but make sure that what you select fits you. Because people will recommend a whole lot of things, but if it doesn't fit your needs, it might not work for you. Okay? So consider that. Also, for me, I told her I wanted to look for plans that had zero premium. I didn't want to have to pay any extra above what's going to automatically be taken out of my Social Security. I wanted 0% premium. So if that's something that you want, make sure you tell your broker that. Okay? So that's what I wanted to share with you. And also, if you do plan on going with the original and you get supplemental, just be advised you're going to pay separate and over what comes out of your Social Security check. You probably will have to end up having a separate bill for supplemental insurance that you will have to pay. So, yes, that's some things. If you have any comments, suggestions, feedback, questions, they're very welcomed here. I hope that you will like, share, subscribe. Until the next episode, I'll talk to you later. Bye-bye.